23 babies were born to the cocaine-using women in this study.
Because the problem has appeared so suddenly, there are few reliable statistics.
The number of so-called cocaine babies is growing at an astonishing rate.
The number of babies born addicted has risen more than 500%.
Between 1980 and 2014, the population of incarcerated women in America grew 700%. This was due mostly to nonviolent drug offenses. This is not because women were committing more serious drug-related crimes, but because of changes in the legislative response to the war on drugs. The specific ways in which the war on drugs morphed into a war on women can be found in the past and present vilification of poor mothers, most often Black and Latinx, who used drugs in the crack epidemic of the late 1980s in American cities. Dr. Ira Chasnoff was working as a researcher at the Northwestern Memorial Hospital in Chicago in the early 80s and began to see a disturbing trend in the babies born to his female patients who had used crack cocaine.
They tend to be what we call jittery.
They're very, very high risk for cerebral palsy, mental retardation.
They are prone to hypertension, strokes, and sudden infant death syndrome.
These children, who are the most expensive babies ever born in America, are going to overwhelm every social service delivery system that they come in contact with throughout the rest of their lives.
From the results of a study of just 28 women and their babies, Chasnoff wildly extrapolated that 11% of mothers in urban areas of the country were using crack cocaine, which would produce at least 375,000 crack babies, unfit for modern society. At the time, other studies were reporting figures like 37,000 to 100,000 to describe the number of exposed babies. But the media took Chasnoff's study and ran with it. In 1982, the year that President Ronald Reagan had officially declared the war on drugs, newspapers ran over 1,000 articles about crack babies and crack mothers, often claiming that neither treatment nor punishment for mothers is likely to improve things because crack addicts typically have no interest in prenatal care. Nothing could be further from the truth. Every major public health organization, including the American Medical Association, the American Academy of Pediatrics, the American Nurses Association, and the Coalition on Alcohol and Drug-Dependent Women and Their Children, publicly condemned the media hype surrounding crack babies, as well as the real-life prosecution of pregnant women for using drugs.
I think that people got very focused on cocaine is the cause of this, rather than thinking substance abuse is the cause of this, maternal lifestyle is the cause of this, social issues are the cause of this.
Nevertheless, in 2003, the Child Abuse Prevention and Treatment Act, or CAPTA, was amended so that states could only receive federal funding if they passed laws to require healthcare providers to report detection of illegal substances in infants to Child Protective Services. CAPTA does not clearly define what is meant by drug affected, leaving states to decide for themselves the criteria healthcare providers will use to identify these infants. Under Alabama Supreme Court rulings in 2013 and 2014, prosecutors can charge a woman who uses drugs during pregnancy with chemical endangerment of a child. Other charges against these women include child endangerment, delivery of a controlled substance to a minor, and first-degree murder. With these laws in place, women who use drugs, legally or illegally, stop going to the doctor for fear of arrest. In the process, they receive no prenatal care and no guidance on what not to ingest during their pregnancies. Years of research have debunked the notion of the crack baby among medical experts, but the stigma against pregnant women who use drugs remains, despite the lack of any substantial research on long-term effects of most legal or illegal drugs. The prosecution and incarceration of drug-using and/or drug-dependent pregnant women, primarily low-income women and women of color, serves the purpose of drawing attention away from pervasive social issues such as lack of universal health care, absence of social supports for children, and the failure of the drug war. In order to combat this misinformation, it is crucial to criticize all news sources and consider the racial implications of mass media and constructions of race and gender.
There's a whole lot of people who feel that if you can just scare people sufficiently about something, that's better than actually telling them the truth about something, because that'll prevent them from doing bad things. I think if you say something 3 times out loud, people take it as fact. And also, I think there's certain ideas that people want to believe that really fit in with cultural stereotypes, and it's hard to get rid of those.
These types of prosecutions do not deter pregnant women from using drugs. Achieving total abstinence from drugs when one is dependent on them is generally a difficult and long-term process that is unlikely to occur in the relatively short term of a pregnancy. As we should have learned from the crack panic of the 1980s, the distrust that stigma inflicts on drug-using women may pose greater dangers to maternal and fetal health than the use of any illicit drug.